Welcome back. So if you are watching these in order, this is my introduction to GME Part 2. If you went out of order, then welcome. I'll introduce myself. I'm Dr. Cariana Brenham. I am your new Associate Dean of Graduate Medical Education and the Institutional Designated Officer here at SIU School of Medicine. So you will be seeing me off and on throughout your next several years of training. And I want to start by welcoming you to SIU School of Medicine and to your prospective residency or fellowship training. And welcome to Springfield. I'm going to talk to you a little bit today about another topic that is very important for graduate medical education, and that is the clinical learning environment. This is a discussion on what I hope proves to be an excellent environment for you when you join us here at SIU. We're going to talk about some of the requirements and some of the expectations that we have for ourselves in training you, but also we have for you when you're joining us here, because of course, residents and fellows help establish and set our clinical learning environment. So we're going to get started here, and we're going to just a quick review for those of you that are watching these videos in order. So with the last video, the introduction number 1, we talked about the Accreditation Council for Graduate Medical Education, or the ACGME, and talked about things like competencies and milestones and the overall institutional common and specialty program requirements. And I invited you all to take a look at the ACGME website and the wonderful mounds of information that you can obtain there to learn a little bit about overall graduate medical education and the monitoring of all the programs are teaching across the country and the expectations for a great learning opportunity for our residents and fellows throughout graduate medical education training in this country. So we'll talk today a little bit about the clinical learning environment and a quick recap and memory on our historical journey for accreditation through ACGME and some of those great moments in time. We talked before about the competencies, and that went into a lot of our discussion on milestones. But today, when we talk about the clinical learning environment, we're going to get into some of those other things that have been approached and looked at across the journey and the history for accreditation and requirements from ACGME. And those include things like the work hours and the emphasis on resident supervision and healthcare quality, patient safety, overall resident well-being, faculty well-being I mentioned was also important, and the new accreditation system really looking at the clinical learning environment, healthcare disparities, and then we already talked a little bit about the educational milestones. I'm going to talk to you a little bit today about what really goes into the needs of a clinical learning environment. And in our institution or our actual learning sites, such as our hospitals or our institution, the SIU setting, gets visits, not from ACGME, but from an offshoot. And these are our clinical learning environment evaluations and visits for our institution to make sure we have a great environment for our learners, in particular our residents and fellows. So what is the clinical learning environment review focused on when they come and take a look at our programs? Really, some of the key points that we're looking at and is needed for a good clinical learning environment are things like a focus on patient safety, and this includes transition of care, healthcare quality, including healthcare disparities, teaming, so working together as a team, not just within the residents and faculty, but our nursing staff, our physical therapists, our caseworkers, and everyone involved in the patient care experience. Supervision is important in a clinical learning environment, making sure residents and fellows have appropriate and adequate supervision during their training, not only to learn, but also to ensure patient safety. And well-being, upholding and making sure we are following the work hour rules or duty hours, and that those residents or fellows or faculty as well that are fatigued because of long hours of work, that they know how to look at fatigue, recognize it within themselves, and manage and mitigate fatigue. And that also leads to burnout. There has been a huge focus in graduate medical education and in the medical practice overall of burnout. And really that stress and the areas where physicians and medical care and other team members in medicine get burned out and really are not enjoying their work anymore and are feeling stressed and not wanting to come to work each day, and being overburdened by a lot of the duties that are upon them. And then that can affect good patient care. Not only affects the residents and fellows or the medical providers, but also affects the patient care and those around them. And so we're going to talk about different ways to potentially identify and hopefully prevent burnout. This is not something that's going to be present in only residency training, but something that is important throughout your whole career. And so being able to look at burnout and overall all of these areas of clinical learning environment and making sure you have a good environment and how to recognize that from the get-go during your training to ensure that this follows you throughout your future careers. The last thing that is in this clinical learning environment is professionalism. And we recognize that professionalism is incredibly important when we're talking about interacting with our peers, our faculty, our other healthcare team workers, and our patients. Professionalism is incredibly important, that everyone in the healthcare team, including those patients of ours, are respected and are treated in a professional manner. And so that's really important when we're talking about the clinical learning environment as well. So this is Tom Nasca, and Tom Nasca is the ACGME president. And actually, as I present this today, he actually is stepping down from this role after many, many years of as serving as president of the ACGME. But one of the things that in his wonderful career that he stated about graduate medical education is that we are asked to demonstrate that involvement of residents actually improves patient care and quality. And so we know that education for residents is important for you, and for you as residents and fellows, and it's utmost importance to provide the best educational experience for you. But we also argue that patients have better care and better outcomes if they are seen in an educational environment, and in a graduate medical education really helps improve patient care. And so we really are asked to demonstrate this, and we truly believe that at our institution. And we hope to show that to you when you're here, but also to show that and demonstrate that to our patients, and really prove that our clinical and learning environment is better because of you being here. So you may be coming in and saying, you're an intern, you're a starting fellow. What can you do to improve the quality of care for patients? And really, there is so much that you can do to improve patient care. And learning that in residency or fellowship really helps set those expectations for yourself for your entire career, and really gives you those skills to ensure great patient care as you go throughout your career. So what can you do to improve the quality of care? Really approaching patient care in a really respectful way, and remembering to put the patient first, and to remember that the care of the patient is incredibly important, and really thinking about every different interaction that you have to be talking about patient care, it really thinking about their life depending on it, because it just might. And one of the big areas that we look at is patient handoff. with duty hours and with work hours or anything in medical care, when you are taking care of your patient, you can't be there 24/7. And so that handoff to the next team, relating and communicating with your other healthcare team members is incredibly important to ensure good quality care. And so good handoffs is a huge area that we as medical team can look at, making sure that we have the best patient care through handoffs, but also maybe where there can be improvements. And so this is something that residents and fellows often participate in. Patient safety investigations, RCAs, which are root cause analysis, quality projects. So this is an opportunity for you if you see something that's not working to the best of its possible processes, the ability for it to be working, for you to say, hey, what can we do to make improvements? And actually, in your residency training and fellowship training, you'll be required to participate in a quality improvement project. And so I invite you from the get-go to be aware, keep your eyes open to things that you think aren't working quite right and could affect patient care. And feel free to point that out to others and to start some investigations or to look at ways that we can make improvements. If we have a poor patient outcome, we're going to look at patient safety investigations or root cause analysis, really getting to the ultimate cause of what went wrong. And that may lead to quality projects that you may be involved in. We hope and expect for all residents and fellows to report errors that they see. Maybe errors, your own errors, or errors in other healthcare team members, nurses, MAs, faculty, other specialty groups, consults that you may be involved with for your patients. If you see an error, we expect that to be reported. We can't learn if we don't know where the errors are. Even near misses. And so those are things where there wasn't a bad outcome that resulted, but there was almost a miss that occurred. And where we can pick up on those, we would much rather see a near miss than an actual error and be able to make some improvements. We might encourage you to let us know if you see unsafe conditions. And so if processes are unsafe or other conditions are unsafe, we expect you to inform us of that. And if there are opportunities for improvement and supervision and the overall learning environment, or learning climate, this is where you come in. This is where you can tell us where you see that there could be some improvement. And quality improvement projects may be right up your alley in these areas. One of the big things that we have had in the past few years is quality improvements projects around transitions of care. We had those that are sign-offs from maybe one team to another specialty team. We've had transitions of care from the inpatient setting to the outpatient setting, and from maybe the day team to the night team. And we've had residents involved and projects that are looking at those transition of care. A few years ago, we had every program report on a transition of care situation that they may encounter in their patient care experiences and what they did to improve that transition of care. Currently, right now, we're looking at transition of care from one team to the next because of a change of rotations. So some programs change rotations at the end of a month or an end of a 4-week block. And that has got a whole new team coming in and taking care of a patient that is continuing in the hospital and continuing in a service. And so we're looking at a project to look at that transition process. Transition of care is of utmost importance, and whether that is by phone or on the computer or inpatient transition, it really is important that a dedicated process is followed the same way each time. Quality improvement projects. And so you see a great picture of hand washing here. This was a huge quality improvement project. We were seeing infection rates increased in the hospital. And one of the things that was pointed out was are providers, physicians, residents, nurses washing their hands well enough? And they actually did a like secret shopper where they had investigators watching to see the hand washing before going into a patient room and coming out to see what practices people were following. And, to tell you the truth, the best hand washers were our nurses. And so we really looked at that and said, okay, what can we do to have a project in place that really encourages everyone to have great hand washing to decrease our infection rates. And a lot of work went into this project and really a lot of resident time also as well, because residents were part of this project and really had great outcomes at the end. One other process that had resident initiation and support in the process was our timeout process in the surgical suites. And this has been in place for a couple of years now. And we really see the improvements of making sure the whole team comes together before surgery to know who the patient is, what the procedure is, what are the risks, what are the possible outcomes that they're expected. And that way the whole team is on board. And really, this is a project to improve communication. Communication is so important in medicine. And this was a great project and quality to show this. So what can you do to improve quality of care one-on-one with your patient? Every time you talk to a patient, think about the fact that you're trying to provide the best care. Sit down, introduce yourself to that patient. Tell them your purpose and what your role is on the team. Patients often become very confused when they're in the hospital. They see so many different people. And don't be surprised if they don't know what team you're with, who you are, what your role is. Let them know that you're the physician, that you're part of maybe the family medicine team or the general surgery or the GI team, and what your role is and what you're there to talk to them about that day. Have the patients paraphrase a plan for you. Ask them what questions they may have. After you've told them what you're going to do, ask them to repeat that back to you. And so making sure they understand the plan that you have in place for them. That really can improve the overall quality of patients. What can you do to improve quality of care? Also, be an effective supervisee. So we will talk to our faculty. We will talk to our program directors. We really work to make sure our faculty provide the best supervision for all of our residents. But you can also be a good supervisee. Listen, be accepting of feedback, be there to learn, ask questions, and be ready to provide the best care to your patients and learn the most at the same time. So overall, what can you do to improve quality care? Really embrace feedback, set learning goals, invite feedback and assessment, utilize objectives and milestones. Give honest feedback to your programs. If programs don't hear honest feedback, how are they supposed to improve? There are a lot of different opportunities you'll have throughout your residency training on surveys, in person, to give feedback. Let your program know what you think needs improvement. Seek out coaching opportunities for yourself or seek out opportunities to be coaches to others. Really embrace anything that you hear from others and be ready to give feedback to others. Really, that's what it's all about, is that opportunity for great communication, everyone being on the same plan or on the same page and with the same goal in mind, and that is to improve patient care and to improve the learning for yourselves. So just a few more weeks until I will see you in person. But in the meantime, if you have any questions or comments or anything else you'd like to share, please feel free to come and seek me out and let me know if you have any feedback. And I look forward to seeing you in a few weeks. Best of luck and see you soon.